Many of them were not in stock, so it was pretty difficult to get the home tests. And we even timed a shipment to a pharmacy when they were expected to get one, but they had ran out when we got there.
Yeah, you may be in this situation this week as well. Those at-home COVID-19 tests really flying off shelves as folks saw family for the holiday. But one family doctor doesn't want you to get this kind of false sense of security from those tests. Our Brittany Thomason is joining us now with what to know about the results. Hey, Brittany.
Hey, yeah, Whitney, those at-home tests are great because you get results within 15 minutes. But the problem, doctors say they can give you false negatives and then that false sense of security.
After getting exposed to COVID, Dean Russian spent the last week woodworking from his Phoenix home in quarantine.
In my circle, I would say about 50% of those people have tested positive or had just recently tested positive in the last week or so.
But it took him 3 rapid tests before he came up positive for the virus.
When I got a positive the third time, I said I knew I was positive. It was just a matter of time, and I proved to my fiance that I was not faking it anymore.
Phoenix doctor Frank LoVecchio says false negatives are common with those at-home quick tests.
If you took 100 people that were positive on PCR, you would miss about 15% of those who took the home test or the antigen test.
That's when medical staff supervise or give you a rapid test. LoVecchio says the accuracy drops even more when you do a take-home test that's not supervised. In that case, he says you miss about 36 out of 100 positives. If you have symptoms or were exposed to someone with COVID, LoVecchio recommends getting a PCR test in addition to that rapid test.
Everybody knows it's hard to be aggressive on yourself when you're hurting yourself. We in the hospital go a little bit deeper. We go where the virus likes to sit, okay? So it's a little bit more accurate.
Thankfully, Dean quarantined before he got that positive result, but for others who don't, they could be spreading the virus without even knowing it.
We've got lots to plan around those test results. So you have the next 10 days of being able to leave your house hinging on those results.
I looked up appointments for PCR tests this morning, and Walgreens and CVS seem to have limited appointments, but I did find it was pretty easy to get same-day appointments at several Embry Health locations. Whitney?
Lots of good information, Brittany, but when it comes to those PCR tests, how long are those results taking at this point?
I got a PCR test from Embry Health this morning, and I was told it takes about 24 to 48 hours before you get those results.
Okay, good to know. Definitely a window we have seen change and one that will change with each provider. Thank you so much, Brittany.